have a company that uses your NPI number or your P10. And basically what she's asking is, if you now go off onto your own business, does that company need to, basically discontinue your NPI number or P10 number, or, how does that work?
Okay, so they don't have to revoke it for you to see a client. So right now, I'm credentialed with Medicare. I can go onto somebody else's business and see a Medicare client, and that person can get paid too. So you can have you can reassign your benefits to multiple, up to like, I think it's unlimited actually. So anywhere you want, anybody you want to see, you can see. So they should revoke it if you're not working with them anymore. But if they do not, you can still see the client. How it works is, when you see the client, Medicare will say, well, David saw this client, but then Medicare will ask in the claim sheet, who is the billing provider? So that is what's going to specify where they're going to send the payments to. So I think, Brianna, for your question, you're wondering if you see a client, will Medicare pay your old business, your old company where you work for, because they have your P10 and your MPI? They won't, because on your claim form, you're going to say that I saw the client, and this bill, the payment is going towards this particular company. So that's how it works, because there are some people out there who work for multiple companies, that do outpatient PT, and each company can bill for that clinician. They just got to tell that will tell Medicare who they're going to pay for that. So yes, they don't have to revoke or discontinue the reassignment of benefits for your P10 number, Brianna. But very good question. I like that question.
I love it.
You, Brianna, 10 points.
10 points. Going back to about the seeing a person and home health is coming in. Teresa asks, is it okay to see a Medicare patient for unskilled therapy, aka fitness or wellness, while they are receiving home health benefits?
Teresa, I love this question. This gets me excited. So Medicare and cash base, this is what I like about it. So I'm going to tell you about a client that I am seeing right now, Teresa. No, what's her name again? I'm sorry. Is it Teresa? That's correct, Teresa?
Teresa, yep.
I'm just want to get this all out. So Teresa, I'm seeing a client right now who is being seen by outpatient physical therapy in a clinic, right? So they just moved from Miami. They came down, they searched online, they found my name, but their son found an outpatient clinic that he's going to, right? So they want to see me as well for the same exact condition. But I can see that patient for cash because I am seeing that patient unskilled, like you were saying. So what I do when I see this client is I call the outpatient clinic and said, hey, I see that you're seeing this guy twice a week. Can I get the home exercise program? So what I'm doing with this client, I'm not doing physical therapy. I'm literally following his home exercise program that they gave him in the clinic at home as homework. So I'm pretty much doing his homework with him that the clinic gave him. And why this is unskilled for, because that therapist in the clinic, he evaluated the patient. So he evaluated the patient, he made the plan of care twice a week for 6 weeks. He made the plan of care ready. Here's your homework. All I'm doing is taking this guy's homework and doing a fitness program with him with the homework that the PT in the clinic made. I don't change anything that he did. I just follow what he did. All this family wants is accountability, and that's what they're pretty much paying for. So you can 100% do fitness with a client. Another great example, with your example, let's say the client is having shoulder pain and they are in the clinic working on shoulder, or they're being seen by home health for shoulder strengthening or something, to that effect. But let's say they want to get fit, more fit, like they want to walk more, they want to do something else. You can do that. That's uncovered, because their walking more is not going to help them with their functional abilities, because this patient, so let's paint a scenario. Sorry, I'm too excited about this question. So let's paint a scenario. This patient comes in, has shoulder surgery, shoulder surgery, and they can't, do the ADLs, or they can't do something that's functional, but they can walk fine, they can do all those things fine. But this patient wants some fitness to stay fit. Their walking is fine, they're not a fall risk. They don't need to walk to get to they're able to walk to get to the store, or to, not to a store, their home health. They're able to walk to get to the bathroom. They can go up and down their steps. They can do all those things. They just want fitness. So you can definitely charge for fitness as an unskilled portion of it. So that's to answer your question, long-winded, but I hope I answered your question.
Oh, I love it. And I think that also helps to answer the question of if someone is in the home and they're receiving home health, and it could be part A or it could be part B.
Yep.
But they want extra. They want more than what Medicare is basically allowing.
Yes.
Can they also step in and see?
Well, we have done that too. So in our practice, what we have done, we've had a patient who was, I'll give you a few scenarios. This patient was discharged from home health and they wanted to be seen on the Medicare. So, we did the evaluation. In the evaluation, we determined that they could be seen 3 times a week. But this patient says, no, I want to be seen, 5 times a week. So we're going to do like 3 times a week for 2 weeks and then, taper off or whatever. But they wanted 5 times a week. So what we did is we did the evaluation on the patient through Medicare, because that's a skilled service. We saw the patient to develop the exercise program, during those 3 times a week. But in between, all we're doing is following the homework. So when we see the client on those off days that they're not being seen for skilled therapy, we're following that home exercise program that we gave them. And we said, okay, first we're going to start by doing 10 squats. We're going to do this, you do this. So we're doing exactly what we gave them as homework. So we have done it in our practice. Or sometimes the client is getting better. So we do Parkinson's. For those who don't know, we do Parkinson's clients. So that's a progressive disease. So we're seeing a Parkinson's client. We do the evaluation. When we're seeing them 3 times a week or twice a week, and all this time, what we're doing is we're developing a plan for them, because this plan is going to get you to do this independently on your own. So at some point, we taper off and say, well, you're doing well. You know the plan. We're going to see you once a week now. They say, oh, no. I want to be seen more than once a week. I like when you come here. It keeps me accountable. But for Medicare won't cover that because they can do this on their own. So that's when you say, well, your insurance won't cover this, but here's our cash rate. We can continue seeing you through Medicare and through a cash rate service where you can continue seeing me, and I can hold you accountable for your exercises. Remember, Medicare pays for functional limitations. Medicare does not pay for accountability. Medicare doesn't pay for laziness. Medicare doesn't pay for motivation. They don't pay for any of those things. So all those things can be built under uncovered services, which when I say uncovered, I mean services that Medicare won't cover. And then covered means services that Medicare will cover. So you can 100% do that.
I love it. And you know what, for those that might want a resource, is there a good resource that they can refer to that lets them know this is what Medicare will or won't cover?
Yes. So there is, and I can't remember the name of it. There is a, oh man, I forgot the name. It's slipping right now. But if you look up CPT codes and the CPT codes that Medicare accepts, normally when you look up the definition of the CPT codes, it will tell you what service will be covered under this CPT code. And don't forget that Medicare covers function. So even when you're making your goals for Medicare, patient will walk 30 feet with the least restrictive device in order to get into the bathroom, or they will improve their balance to decrease fall. So these are the kind of things Medicare is covering: functional limitations. They want you to get this patient to become independent, or sometimes this patient, especially in Parkinson's, they may want to maintain their level of function, and that's where we can come in and do a maintenance program as well. But the maintenance program, again, this is a great program where you can actually include unskilled services. So like I said, if I'm seeing a patient, like we have one patient I see once every 6 months for a checkup with Parkinson's, but in between they want coverage, we just charge cash and say, well, during this coverage time, we're going to charge cash. Now, let's say while we're doing the home exercise program with our wellness program, we are doing this, the patient is still declining, then we can bill Medicare and say, well, we did our homework. We gave patient this homework. They are still declining. We're going to go back in and do our reassessment to see why they're declining, modify their program, and then put them back onto that cash-based maintenance program. But yeah, there's I forgot the name. I'll get it for you guys. But there's a name of a certain document that shows like each thing that Medicare covers. But the main thing is to look for the Medicare covers function. And there's also resources on the Medicare site. There's a chapter 15 Medicare documentation that also shows different things that Medicare covers, like the evaluation of the plan of care. So it's called. I'll find the resource and probably post it in the comments in this live. But there are resources actually on the Medicare website that you can go to. There are other resources out there as well that you can sign up for and go to as well.
Right.